Ladies and gentlemen, Senator Shawn Mitchell.
Thank you, John. What a great crowd of Coloradans and Americans. You know, I wasn't nervous being out here until I heard that Dr. Dixon is a neurosurgeon. I have to confess that I am a lawyer and a politician, and I was afraid he would get close enough to see the abnormalities in my brain. Friends, it's a privilege to be with you today to defend the quality of our health care, the quality of our life, and our ability to make decisions here in Colorado. You know, one big difference between the way we do business here and the way they do business in Washington, when we talk about healthcare, it's not behind closed doors. Coloradans do it in public, on camera. You know what it is. Talking about these important events. We know how important this issue is. It's historic. Kind of like the historic message that voters in Massachusetts are about to deliver to Washington. Massachusetts voters will speak for people all across America when they say, we might be Democrat, we might be Republican, we might be Libertarian, we might be Independent, but we are not stupid. And it would be stupid to give Washington total control of our health care. Now, there are some people who say, but health care is a universal human need, so government has to do this. Well, they're half right. Health care is a universal human need, which is exactly why we don't want to depend on our government to provide it for us. But our concerns aren't just philosophical, they're practical. We see what's going on, the broken process, the broken promises. Do you remember the promises the president made? His plan would be miraculous. It would expand care, it wouldn't increase spending, it would decrease spending. It wouldn't raise taxes, it wouldn't raise the deficit. And best of all, it would be drafted and debated and ratified on C-SPAN. Well, I don't know if anyone in America really took those promises seriously, but it's obvious that Harry Reid and Nancy Pelosi did not take those promises seriously. And so we see the chaos in Washington. I mean, more chaos than normal. You have to ask yourself, if they can't pass a bill about healthcare without creating a train wreck, what makes them think they can run the healthcare system without creating a train wreck? When I'm sick, when my children are sick, when my parents need care, I want a patient to be able to talk to a doctor in a comfortable consultation. I don't want an awkward three-way with a government bureaucrat. Friends, the revolution re-sparks here. The people in that building need to hear we want autonomy over our healthcare decisions, our quality of life, our healthcare dollar. This fight, we're together and moving from three-ways to rallies to fighting. I can't think of anyone better to take the baton than John Caldera.